Well, hello, I'm Michael Seidman. I'm a surgeon, a scientist, and a nutritionist. I am the director of skull-base and otologic surgery at Advent Health in Celebration, Florida. I'm the chair of our department, and I'm also a professor at University of Central Florida and University of South Florida, just so you can see kind of where we're at here. My disclosures are listed here. Where they pop up, I will bring them up. I have a couple of patents on some brain surgery I developed for tinnitus. I have not made any money from it, much to my wife's chagrin and perhaps mine, but we've done some innovative things with tinnitus and we'll share that as well. So the societal impact, 50 million Americans have tinnitus and close to 1 billion people worldwide, roughly 3 million of our veterans. It's the #1 disability now, tinnitus followed by hearing loss. So the #1 and #2 disability of our men and women in areas of conflict. It's about $660 per patient per year, and the VA has paid close to about $5 billion. Um, the neuropsychology of tinnitus is fairly interesting. I don't know if any of you in the audience have it. I have it in my left ear. It comes and goes. It's annoying. The more I think about it, the more it annoys me. The more I talk about it, the more it annoys me. So I'm going to try not to be annoyed by giving this talk. But people, you notice the tinnitus and also like, oh my gosh, what is that? That's something scared. I get worried about it, increased physical stress, increased awareness in the tinnitus, and you have a vicious cycle. It's very much like when I talk to reporters, I say, do you have a light over your head? And they go, yeah. I said, is it mildly annoying? They go, yeah, now stare at that light, right? So we are wired in different ways, all of us. And some of our patients will stare at that light, will listen to the ringing and let it drive them crazy. It's kind of the same analogy of some people have a mosquito bite and say, man, that itches. They scratch it and move on. Other people will scratch to bone. There's a lot of existing technology and options to manage tinnitus. We'll go into some of the nuances of that, but the hearing aid logic or masking devices raise the ambient sound. So a lot of patients will say, I only hear my ringing when it's really quiet. Other people, like me, I'm a pilot, so I can have the engine running in a plane, be near a jet engine, and I can still hear my ringing because it's such a fine-tuned pitch. You can have certain types of sound therapies, neuromodulation. Pavel Jastroboff developed tinnitus retraining therapies, cognitive behavioral therapies. There are surgical options. There's medications. There's a study by Brummett out of Oregon that clearly showed that Xanax is very helpful. A lot of people use amitriptyline. Very interested in the psychedelics. We wrote a book, I think it's behind me, about complementary integrative medicine, and we wrote a book about or a book chapter that talks about MDMA. It talks about mushrooms. It talks about LSD and other things. And one of our co-authors took the 1-year course at UCLA about how to treat patients. So it's interesting. And then alternatives. So I have a degree in nutrition. I've studied herbs, and I can treat most medical disorders with an alternative. Getting into the nitty gritty, tinnitus, by definition, tinnitus is any sound to be coming from your head or from your ears without an external sound source. So there's no external sound source, yet you hear a ringing. We've been trying to target this for years. We think it's all coming in from the brain. The primary author here is Dr. Boyer. Elisevich here is a neurosurgeon I worked with, and we started to use magnetoencephalographic studies, to try to determine if it can pick up where the tinnitus is coming from. So tinnitus is a phantom sound. We think it's a dysynchrony in the auditory signal. It's an altered state of excitation and inhibition in damaged neurons. We think it's caused by a reorganization of the auditory cortex, and we'll get into that in a little bit more. And reorganization can be demonstrated by a bunch of different things. This is showing you a picture of fMRI. We also think that reorganization can be influenced by TMS and electrical stimulation. So there's now something called Lenire, which we'll talk about towards the end of this, which is something you put on your tongue, paired auditory sound, and we think we can lead to reorganization. If you look at this fMRI, my best analogy that I tell people is, if the map of the United States, all 50 states, well, Alaska, sure, but not Hawaii, you can say with fMRI that the ringing is in Florida. magnetoencephalographic studies that we've looked at, can tell us that it's in Orlando, Florida. So it really helps to kind of narrow that down. So it's a technique for localizing sources of electrical activity within the brain. And this is MEG detection of tinnitus. This is a person who had severe left-sided tinnitus, and you can see the hot spot in the right auditory cortex. And then this is a control subject that really does not have tinnitus, and there is no specific hot spot. And so we published a number of papers looking at MEG as a localization of the putative cortical generators of tinnitus. This is my colleague Dirk de Ridder from Belgium. Now I think he's in New Zealand. We did the first surgery ever in the world where we implanted electrodes into people's brains. He was using fMRI, and then that's a TMS system, the little paddle that's on the head. I got to visit Belgium, and we tell people do not try this at home. If you've had transcranial magnetic stimulation, it's not terribly unpleasant. It feels like somebody's snapping a rubber band on your head. The studies are pretty all over the board, but basically say about 40 to 55% of people will have improvement with tinnitus. They've also done sham tinnitus. We've also looked at cortical electrical suppression of tinnitus and modulation and its related neural activity. We published this as well. This is, a map of the brain looking at the auditory cortex. And then this is what a MEG looks like. So this particular patient, he was the first patient we ever did, and I was awarded a couple of patents on this technique. But we used fMRI and then MEG, and then we were able to find two spots. You can see the spot on the left was about 8,000 hertz. The spot just to the right is about 12,000 hertz in Sylvian fissure. We did a craniotomy. We used MEG, that's that little needle looking on the cortex. This patient was awake for the surgery. We implanted an electrode lead, put an implantable pulse generator in the chest with the concept of trying to electrically jam the tinnitus. We did this patient. I cured him. I thought I was going to win the Nobel Prize, but we did 6 others, not so much. So with the 7 patients we implanted, 1 was a cure, 2 had no response. We also targeted their limbic system. So I implanted electrodes into the anterior cingulate gyrus and the amygdala in addition to the Sylvian fissure and the auditory cortex. And then next 6 were done with just a simple burr hole and not an actual craniotomy. And this is the paper behind it that we published in 2008. This was kind of moving on a little bit to vagal nerve stimulator, hearing loss or noise exposure, and this deals with some of the work that I've done with the Department of Defense and the military, and changes the plasticity and leads to tinnitus. And so we think the concept is that this alters the neuroplasticity. So this is a proposed mechanism. And what we know is that vagal nerve stimulation, so it's used primarily for seizure disorders and depression are the 2 primary indications. You implant on the left vagal nerve. It alters acetylcholine and norepinephrine, and it affects the locus coeruleus and the nucleus basalis. And then, I don't know if this will come up with sounds, but the top bar is showing you a normal auditory cortex, and then the bottom bar is showing you a distorted auditory cortex map. I can hear those sounds. I have a small Eskimo that wasn't very happy, but this is work that we didn't do. This is Dr. Engineer, actually that's his last name is Engineer, and looked at neuroplasticity, reversing it, and basically they did the vagal nerve stimulator with paired auditory sounds, and we were one of 4 sites in the world doing that. We implanted 11 patients, the other places implanted about 9 or 10 as well. We found it to be about 60% effective at reducing tinnitus. So this is just a picture showing you the nerve stimulator on the vagus nerve, an electrode, and then we also did an implantable pulse generator, and this is one of the papers that we wrote about that. So nobody wants to really have their brain open, and nobody really wants to have their neck open and risk vocal cord paralysis and such. We had none, by the way, but in the group of 40, there were 1 or 2 patients with vocal cord paralysis. But Lenire is an FDA-approved device. Our audiologists offered to patients, and what they did is they're basically stimulating the tongue with a little electrode on your tongue and then doing paired auditory sounds. The long story short is roughly 86% of people who were compliant showed improvement in their tinnitus when evaluated about 12 weeks afterwards. And they used specific validated questionnaires. This is the TENT-A2 clinical trial with 191 participants, and up to 95% of patients really noted improvement. And at their final visit, about 87% said that they would recommend it. So the dorsal tongue has a high nerve density, the lingual branch of cranial nerve 5, trigeminal nerve, and there's a link between this and the central auditory structures, as we believe. And we think that the stimulation will suppress activity within the cochlear nucleus neurons. So it's designed to deliver sound stimulus in association with the electrical tongue stimulus. This was some work that I did for a company. I was their medical advisor for a number of years. They are traded on the New York Stock Exchange. Maybe that's not true, the NASDAQ. I did buy 1,000 shares for $6 a share. It's now at about $1 a share. So don't follow my investment advice. But AM101 is very interesting. Looks at NMDA receptors as a pharmacologic target. Activation of the NMDA receptors in glutamate excitotoxicity is seen in noise trauma, barotrauma, things like that. And it is thought that tinnitus may be a result of NMDA receptor-mediated aberrant excitation. So there have been studies to look at this. What we showed is in the highest dose, the tinnitus annoyance was statistically significantly reduced. The tinnitus loudness statistically significantly reduced. Sleep difficulties statistically significantly reduced. And on the impact tinnitus handicap inventory, it was also statistically significantly reduced in the highest doses of AM101. One of the things that I did when I was at Henry Ford Health System in Detroit was I started the Center for Complementary and Integrative Medicine. I have a degree in nutrition. I've studied herbs for a long time. I had mentioned that my undergraduate degree at the School of Public Health at University of Michigan was in human nutrition, and then I went to medical school there as well. I got $1 million donation from the Ford Foundation, built the first Center for Integrative Medicine. We built this up to 1,000 patient visits. We had holistic nutrition, we had TCM, traditional Chinese medicine, we had acupuncture, herbal therapies, we had naturopathic therapies, we had chiropractic, we had yoga, tai chi, the whole 9 yards, and it was a lot of fun and very interesting. With that, I'm going to segue to kind of the final things here and try to wrap this up for you. I'm a big believer in alternatives because we don't have all the answers, and if you think about it today, most of our pharmaceuticals have come from botanicals, right? From trees, from leaves, from different things. I'm a big believer in alternatives, and I am not a coffee drinker, mostly because I'm not old enough to drink coffee. Actually, I'm 150 years old. I just look like I'm 50 something. But I do drink tea, and I don't like the flavor of the tea, and I do have a tea routine. So if you YouTube my name, Dr. Michael Seidman, I have about 60 videos on my YouTube. There's kind of a tea video, which is kind of fun to watch. Most people think I'm a little bit of a nut. But with that in mind, I want to talk about the nutrients that have been studied with tinnitus as alternatives. So magnesium is critical, calcium, potassium, lipoflavonoids. A lot of people ask me about lipoflavonoids, B vitamins, and multivitamin supplements. I am the founder of Body Language Vitamin Companies. That's one of my disclosures, and Peak 365 Nutrition. I've been designing nutritional supplements for years. Nothing that I've designed specifically for tinnitus, although I am a big fan of a company called Arch's Tinnitus Relief Formula. I have nothing to do with them. But they have a beautiful formulation. I helped them build it years ago when I was a medical director, but I stepped aside because I got chastised by some few small people in my group who thought that I was selling herbal therapies, and I really wasn't. You can see the list here: B12, beta-carotene, selenium, zinc. Zinc is very highly concentrated in the brain, in the eyes, and in the inner ear. There have been many studies to look at this, and it's just like anything else. If you don't like what you hear, wait 5 years and it'll be reversed. So a few years ago, remember, coffee was really bad for you. Now it's really good for you, and now it might be bad for us again. So you can argue about everything in moderation, but I think there's a book out there that says moderation kills. The long story short is that there have been studies to show that people who have supplemented with zinc can do better. what about herbal therapies? And this is where I'm going to wrap things up. There's a bunch of different herbs that may be of some benefit. One of the most widely studied is ginkgo biloba. Significant effects in cerebral insufficiency, memory, and cognitive improvements. There's a number of uncontrolled or controlled but not randomized studies. There's a total of 19 controlled trials at the time, with five placebo and 3 with other medications, and 10 out of 11 open trials showed improvement with ginkgo. 5 randomized controlled trials using ginkgo biloba showed improvement over placebo. And then there was 1 randomized double-blind placebo-controlled trial out of Edinburgh Drew, and this is what most people quote, which is why they say that ginkgo doesn't work. It was, no offense to Dr. Drew, but it was a very poorly designed study. They used 150 milligrams of ginkgo biloba per day for 12 weeks. The standard dosing, if you look at the German Commission E, which is the best medicinal resource for the use of herbs, says that you need 240 milligrams twice a day. So in my mind, the dose they use is a little bit like saying, gosh, you got a blood sugar of 500, let's give you 5 units of insulin. Probably not going to be enough to lower it. So I thought it was a very poor study, yet it got published, and that's what people tend to quote from that perspective. A lot of studies have shown that ginkgo biloba is helpful. When I tell people to try arches, they have ginkgo, garlic, and zinc, and then they have a multiple formula and a B12 formula. And then I tell people they give you 100 days worth for about $170 or $180. I tell them to try it. If it works, keep taking it. If it doesn't work, stop sending them your money. Ginkgo biloba is one of the 4 Gs that I think: ginkgo, garlic, ginger, and ginseng, which can all affect bleeding. So theoretically, if you're on a blood thinner, you're not supposed to take ginkgo. My argument is just take less of that prescription blood thinner. We've published a number of articles. This is current opinion management of tinnitus. You can feel free to review. And if you're ever in Orlando, please come visit. That is my email address. And I managed to do that in 16 and a half minutes. And I hope you learned something and had fun. Feel free to reach out to me via email as well. And maybe you'll look at some of my videos. I do have one on tinnitus that's about 30 years old. And I joke 3 things have changed. One is I recommend a specific type of ginkgo. I tell them, consider the arches. I developed a brain surgery that doesn't work very well. And 3, I had more hair. Thanks a bunch, and come visit.